Hello, we're here with Angela. Angela has agreed to share her initial visit with us. It's her first time here to the office. So we're going to capture her first adjustment, and then we'll first go over some of the things that she came in with. Say hello to everybody.
Hello, everybody.
So Angela is struggling with some areas of pain. Correct me if I'm wrong in any of this stuff. Just chime in and say that's wrong, that's right.
Gotcha.
All right. So back pain. She's having some mid-back pain starting around, is it the shoulder blade area? Going down the right side, your arm, all the way down to, I have the thigh.
Yeah,
but
it'll go through my thigh.
Through her thigh, all on the right side. It's been going on for a few years.
Correct.
You take ibuprofen for it. Most of your pain, you rated an 8 out of 10, which is kind of high, right? And she takes ibuprofen. It kind of sometimes just lessens the intensity of it, but nothing really gets rid of it.
Right.
Neck pain,
yes.
Ringing and buzzing in ears. That's also started many years ago. That radiates or part of your right arm. Neck, upper back, shoulders, it's constant, doesn't stop. Lower back pain too. Here's this lower back right side. Everything's right-sided. Down into her buttock, hip, and down the outside of her leg. So she has a bunch of different areas of pain and discomfort. In 2007, she had a head-on collision. And that resulted in the driver. Describe the accident, what happened there.
We were doing a U-turn, and the driver went right into a pickup truck that was going 50 miles an hour probably.
And then you went, where did the car go? It hit
Our
you?
car?
A head-on collision.
Yeah,
it hit you
we
head
were
on.
head-on. Yep, car was totaled.
She's had a couple falls in her lifetime, steps, bike, things of that nature. Sleeping issues. You can get to sleep, but you don't stay asleep.
Right.
And it started about 2 years ago. I also have left knee pain. Woke up 2 years ago with swollen knee, and it's bothered you ever since?
Off and on, yeah.
Off and on. And then wrist pain. I have. So these things occur from just different of life. You know, we have these symptoms. People come in with these symptoms, health issues, and it's a result of just things that have happened from the time you're born to this moment of time. And so we want to address causes, and that's what we're trying to find here. So we did some things on her to look at what could be potentially causing these symptoms, because you could do one of a few things when you're dealing with this. One, you could just deal with it and let it go and just learn to live with it. You could take drugs to cover it up, and you're just dealing with covering up the symptoms, or you could find the cause and address the cause, and that's what we're doing here. So we did some tests on her that look at stress and tension on her nerves, in her muscles, basically how her body's performing from misalignments and trauma to the spine. And the first one here we're looking at is stress to the nerves. Anywhere you see colors are areas of stress and tension in the brain area and in the nervous system on the nerves. So the colors indicate how much of a problem she has. So green would be mild, blue is moderate, and red is severe. So she has a lot of red here in the upper neck region and then down here in her lower back region. So these nerves, these areas go to different organ systems. And when you're dealing with the upper neck, for example, it can lead to headaches, migraines, difficulty sleeping, anxiety, depression, sinus problems, allergies, menstrual problems, digestive issues. And no one would really relate the upper neck to those things, but it has to do with the nerves and how they leave this part of the body and they go to the different body systems. So we're going to focus on some of our upper neck because there's a big problem there, and then down here in our lower back region. This is muscle tension. This is a normal muscle tension scan. This is what we want someone to look like. It's symmetrical, it's white in color, has a pear shape to it. And then this is Angela's scan, where you see the colors are areas of tension and stress in her muscles. So green is mild, blue is moderate, red is severe. So as you see, she's got a lot of stress and tension in her neck and upper back and down in her lower back region. Imbalance in muscles, which side's pulling harder? Her right side's pulling harder in here in the lower back, and then it shifts to the left. So these are all indications that her body is out of balance, out of homeostasis, out of harmony. And as a result of that, she's experiencing some of the pain symptoms that she's coming in with. So our goal is to get these scans more towards normal. All right, so I kind of relate this to sometimes when people go to, say, a medical doctor and they do blood work and they look at things in and out of range, that when things are out of range, what's the goal? We want to get them in range. Well, we're going to try and do that naturally without drugs here. Find the causes, address the causes, and try and get her body back in balance. And so we'll do these scans periodically to see how she's performing. Now, the other thing is it gives you a score out of 100%, and she's functioning at 79% of her 100% potential. I'm going to try and cover your information here. So it looks at different body systems. It rates you out of 100% in each category and then gives you an overall score. So she's functioning at 79% of her 100%. She's in transition phase. In other words, if left uncorrected, this can get to even more challenged or even very challenged and lead to more serious problems. So we want to intervene and go in the opposite direction. Correct these and give her a higher score. We talked about the 4 kinds of stress that lead to these things. Physical stress, things that happen to us in our lifetime, from the moment we're born or even in utero to now. Car accidents, falls, traumas, posture, sports. I mean, there are hundreds and hundreds of things that we do in the course of a lifetime that have affected us physically. Emotional stress. I mean, just think of the world right now, all the emotional stress and trauma that people have been through. Chemical stress, and those are things like prescription drugs, over-the-counter drugs, recreational drugs, too much caffeine, alcohol, processed foods, things that we put on our inner self that are chemically stress us out, and then electromagnetic frequencies. All this Wi-Fi and everything around us that's affecting our nervous system and body. So these stresses are what create problems in the spine, and those spinal problems manifest physically in many different ways, known as symptoms and signs. So that's a little explanation, a rant. Do you want to add anything to that?
No.
No? So we also looked at her x-ray, and that's what's behind us here. Not going to turn you into a radiologist and go into all detail. However, you can see she's not crooked. We're looking at her as not crooked. She's crooked. We're looking at her as if she's facing a wall, and we're looking at her from behind. So pelvis is tilted and rotated. She has a scoliosis, a curvature of the spine. Lumbar spine is tilting to the right here, then it tilts to the left. And then she's tilting to the right all the way up. And look at her head. Her head is off to the right. It's off center. Her shoulders are uneven. Her hip height's uneven. The curves in her spine are exaggerated or not normal. So the neck curve should arc this way, and it starts that way, but then it goes in the reverse pattern. It's actually reversing, creating a stress and tension on the scans that you saw. So these x-ray distortions create a distortion in someone's body and how they go through their day. So she's walking around like this and sitting like this and doing things like this, and this is how these things show up and affect someone's health. So, any questions? No. Do you have any questions? If you do, put them in the comments or wherever this is and ask, and we'll answer. So we're going to do our first adjustment, right? Come on over here, Angela. Please. You're going to sit in this chair and face that way. So her last adjustment was in 2012, 2013, somewhere in that area.
Yeah.
It's been quite a while. I'm meeting her spine for the first time today. So we start off doing a little scan. Angela, I'm going to run this down your spine. This helps find subluxation, as we talked about it, the misalignments to the spine. So we're checking her spine, comparing temperature on either side of her spine. And if there's a big area of difference, that's an area of misalignment that we want to look at. So she's got one here, one there. So we're going to mark these areas just so we could come back to them and feel. You got one up here too. I'm gonna go under her shirt here, Miss Angela. All right. Check her neck out one more time. Right there. That was an easier one to see. It goes one way and breaks the other way. Okay. So I'm going to feel. I'm going to feel how your spine is moving. It might point things out along the way. You have a ton of pressure up in there. I think I said that to you on the initial visit. She's got a ton of pressure in her upper neck. I could feel it. And she said she's hurting today. Yeah, feel that? Sacroiliac joint, pelvis, locked up and swollen on the right side. So we're going to bring her to this table. Angela, I'll have you come up on this table.
Okay.
Face is going to go where the paper is, and then your hands are going to go on these pads.
Okay. Ooh. This is scary.
Sorry for the wobble, people. I almost fell on my butt.
Now, do you want to talk about your son for a while I'm doing this a little bit, or no?
Oh yeah. We brought him in, and immediately he started sleeping through the night and stopped grinding his teeth throughout the night.
Yeah, so he's how old?
5.
So brought her 5-year-old son in. He was having some sleeping problems and asthma, right? Asthma, breathing, asthma, breathing, sleeping issues, not sleeping through the night, and he was on. I know he was on some medication for the breathing.
Right. So he's transitioned off of one of the medications. We haven't made the switch yet with the other one. We got to kind of decrease that over a couple months, but he's doing wonderfully with his breathing as well.
So his breathing's improved. He's sleeping better. He's sleeping in his own bed now, right?
Yep, through the night.
Through the night. So you're talking about a 5-year-old who is having challenges, and we don't look at them that way, health challenges, starts getting adjusted, and it was fairly quickly, right? Within the first...
He slept in his own bed, I think, after the second adjustment.
So second adjustment, he was sleeping in his own bed, and he's doing better overall. So you're talking about a different health trajectory for a young little man, and he's a little stud man.
Yeah, he is.
Yeah, he's gonna be a lady killer at some point.
He loves coming here.
He knows exactly what to do too. He goes on each table. I'm gonna scoot you up a little bit.
Okay.
You let me know if you're comfortable on the table.
Yeah,
Right? Let me know if you're comfortable, if anything I do is hurting or irritating you. Doesn't mean I'll stop, but at least let me know.
Sure.
No, I'm kidding. So we're gonna start in her mid-back. She has a few. She has a T2 up here. She's a T5. All right, so I'm gonna come over on this side. So you're gonna feel me just kind of lean into you, Angela.
Okay.
You're gonna feel me just kind of squish you down, and I'm gonna push through, all right? Your job is to drop your shoulders down, let everything relax. You may or may not hear a pop. That popped, but not loud enough for those guys to hear it. Yeah, you got a lot of... I have to break through some cement here. I'm going to try a little bit higher here. You're going to feel me lean a little bit, push. Good job. So T2 and T5, really tight, really locked up here. But that's going to be contributing to some of the symptoms and pains he's feeling in our mid-back and down our arm. He also has a T11 here, so let me adjust this T11. This is in a transition area. This might feel a little weird, Angela, because it's kind of in a transition area. So you're gonna feel me lean into you here and push. Good. And check your knees out. All right, so I'm gonna use this little, called a speeder board on her knees. It helps adjust the knees. You're gonna feel me push, and it's gonna drop like that, all right?
Mm-hmm.
You okay so far?
Yeah.
You have anything to add, Sally?
No,
The camera woman?
no, not today. You said it all.
I'm gonna bring you up here, Miss Angela. When the table comes up, you're gonna turn around and lay on your back, right?
Okay. I feel like Frankenstein. They're like laying on the table.
People either say Frankenstein or Darth Vader, depending on the era they've grown up in. Continue to work on her knees here. Foot. Foot. Good job.
I heard that all the way over here.
You're gonna feel me pull this way, okay?
Mm-hmm.
And you might feel that in your knee and or your hip. All the way up into your hip. She's probably being really careful not to scream or like make weird faces on video the first
Or drop
time.
F-bombs.
She's probably like, in her head, she's like, oh my goodness, I really, you can, you know, be vocal, whatever you need to do. You know, they won't mind.
We'll rate it R. It's okay.
Yeah, I mean, I don't know if we have beeping capability, but you're gonna feel me just stretch you. Let's elongate your body. Good job.
She's like, all right.
So I'm gonna just work out some of her scalene muscles here.
This feels great.
So this is gonna be, it might be uncomfortable a little bit because I'm dry. I'm dry pushing here. I'm not using any like cream or anything. So I'm doing it purposely to just try and.
Knew that was gonna happen. I was like prepared for it. Nothing. I just knew the chair was gonna pop when I sat on it.
So you let me know if this is too much, too little, but if it's uncomfortable, let me know, because
No,
I know
it's
it
not.
can be. And all I'm doing is going down the scalene muscle here and muscles along the side of the neck. The whole idea is to just break up scar tissue and elongate this muscle. These get really tight from us leaning forward anymore, looking down, using our phones, reading, driving, using a mouse at a computer screen, anything where we're looking down or have our arm extended.
Yeah, that's me.
Can I get some of that too?
What, this? Now sometimes you use a flat thumb, it's a little less intense. If you want to really get more specific, you use more of the tip, and you can really get into the muscle belly.
She fall asleep?
I could. I could.
In her head, she's really cursing me out.
No, I'm
No,
not.
I'm
I
just kidding.
swear.
So this side is definitely tighter.
Yeah, I can feel that.
This side is a lot tighter. Like I said, some people use cream, some people use a massage oil or cream. I'm not that nice. I just go in and, you know, dry work this out and just tear tissue away, scar tissue.
You know, I didn't get your face on there with your big cheesy smile, like, yeah, I love this.
I just have my hands on her occiput, base of her skull.
Doesn't that feel great? That's that's one of my favorite things.
And just kind of glide the spine a little bit, trying to just get mobility. A lot of times this part of the spine gets locked up, and there's a pumping mechanism between the base of the skull called the occiput and the sacrum in the pelvis. And it helps pump cerebral spinal fluid through, but it's, you know, a pumping mechanism. That gets affected when we have misalignments. All that whole system gets jammed up and it doesn't move right. So I'm just trying to get some movement back into that. And along the occipital ridge here, which is part of the back of the skull, where the trap muscle inserts into. These, on a lot of people, are just very overworked, tender, sore. Feel all those guys?
Mm-hmm.
So I'm just going over them.
She's cool as a cucumber. She's like loving every second of it.
Yeah, a lot of people curse me out and with
not
this,
this one.
and,
No, not at all.
and they swat my hand away or something. But she's doing well.
I'm pretty sure my daughter would be like, get off.
Yeah, she doesn't like when I do things like this to her.
No.
She's like, ow, cut it out, stop it. Jumps off the table.
I'm sure. She hates being touched.
Sometimes you can do something called a cervical stair step, where you put the spine, kind of glide it. And as you get up there, you again just create mobility, break up scar tissue. All right, I'll keep asking you if you're okay, just because
I'm all right.
I feel like, you know.
She's like, yeah, I'm all right.
My goal tonight with her is to hopefully let her body have the best night's sleep she's had in a long time.
I hope so as well.
Do you not sleep well, Angela?
I fall asleep fine, but I can't stay asleep.
Did the GABA work? Didn't I give you some GABA?
Mm-mm.
I didn't. Thought I did.
All right. I'm going to bring you up, Miss Ange, and we're going to go to...
Careful you don't fall over.
Yeah, when you come up, make sure you have your balance. And,
Alright, where am I going now? Okay.
This table, you're going to lay on your side and face me. So your shoulders are going to go here and your head's going to go here.
Okay.
I'm going to bend this top leg,
Okay.
straighten the bottom leg. You kind of hug yourself. I'm going to bring you closer to me.
Okay.
So we're going to adjust her sacrum on the right side. It's almost going to feel like I'm kind of laying on you, so don't punch or kick me off.
Okay, I promise.
All right. Roll you towards me, stretch you out like a rubber band, lean. Good job.
Oof.
How'd that feel?
Oh, that was good. I didn't expect it though.
We're gonna go back to this chair actually,
No.
and see if I'm gonna do anything else to that or leave it.
Okay.
Because really, it's a lot of your right side.
Mm-hmm.
Did you have numbness? You don't have numbness or tingling down your legs, right, or anything like that?
No.
Except this thing on the outside here.
Yeah, it's like dull pain.
I'm gonna adjust your shoulders, so just gonna bring it back this way.
Ooh.
Same thing here. That was some
Well, I
audible
didn't know
from
that-
those shoulders, huh?
I didn't know that could do that. That's cool.
I don't have microphones set up yet. We're not that sophisticated to put microphones on people's body parts or near around to
that'll
really
get you the views.
magnify the audibles, because people love to hear the cracking noise.
Well, that's why I'm gonna get close to you when he does your neck.
So like, but she audibled a lot through here. It just wasn't magnified.
Yeah, I didn't hear anything
But
till
she
the
had
shoulders.
some good sets. She had good adjustments over there. The thing with this technique is you're not looking for the rip-roaring cracking noises.
Right.
You really just want like a solid thunk when you adjust it. You're not going to hear it like you hear on all the other. By the way, I'm adjusting your wrist and fingers.
I figured.
You just wanted to see if you were really a rag doll.
You feel me just pull. I'm trying to pull your thumb out of the socket. No.
Get me out of work tomorrow.
So we're going to go for her upper right neck. So this is right behind your ear, okay? I'm going to have you lean back in the chair. I'm going to put this strap around you so you can't run away
Right.
or escape. This is going to be right behind your right ear, all right? So the noise, it may be a little louder. It's right behind your ear. You're gonna bring your head to the right, and you're gonna feel me push that way.
Oof.
Good job. You really can't explain what that's gonna feel like to somebody.
Except for that it feels really good.
Yeah.
The first time, it's just inexplainable, really. Yeah, and just checking for glide. I always want to check my work after I work on somebody. I want to make sure that things are moving right, or we made a change. Because you can't just go by the noise. The noise is one thing, but it doesn't mean you corrected anything. All right. So that was her first adjustment. Everything go okay?
Yeah.
All right.
So we want to thank her for allowing us to share her video. And any questions, put them in the comment section or
Comment
area?
section.
Comment section.
Yeah.
I'm gonna try and answer them for you. But thanks. Be well. And if you're not under chiropractic care, find somewhere to go and get checked.